doing a heart dissection, sheep heart. Okay, and rather than cutting off 100% of the fat, we're just going to focus on the great vessels at the base of the heart. This is the apex, which is actually the bottom. Base of the heart. Base of the heart is the top. Our classroom camera is not lined up with our phone camera, but that's okay. We'll do that later. So let me just actually get right into it. Get my tools. And right here, you can see, this is terrible. I gotta focus. That's fine. So you can see right here, there's a bunch of fat. Always, once we think you can identify the anterior and then identify the posterior. The anterior is generally convex, okay, generally kind of rounded, depends on how they were stored and shipped. The posterior is almost flat, sometimes concave. This one's kind of flat. Another real good indicator is the interventricular sulcus, which is right here. There's the right ventricle, there's the left ventricle. That's normally at quite a bit of an angle, maybe a little more than 45 if you're going looking from here, a little bit sharper than that. Whereas the posterior is almost vertical, sulcus here, okay. And the first thing is pulmonary trunk. I always follow at almost the same angle as the sulcus here. Pulmonary trunk is going to be right at the same angle. So we start there. Okay. You do is try to cut through that fat in between. Got to have a pretty sharp scalpel here. Kind of carve it out. Don't be afraid of pulling really. You can pull really hard on the tissue. The vessels will not break by pulling very much, but only by cutting. Okay, so that's all. Basically, just separating it. You can see here. I think that's the brachiocephalic trunk. They cut them so close, it's hard to tell, but that's usually the brachiocephalic trunk, and then the left common carotid. Remember, the brachiocephalic is different because that branches later into the right common carotid and the right subclavian, whereas the left, it branches right off the aortic arch to the, that would be the left common carotid, left subclavian. Okay, so again, that you can't see it here. It'll branch right off the aortic arch. Again, it's not visible in most of these hearts that we get. So they cut them pretty close. You'll find that for the majority of the heart, a lot of the blood vessels are not as easy to find, like the smaller ones, like the pulmonary veins, because they're cut so close. The Vena Cava, or Vena Cava, which is plural, they're cut very close. Okay. So go ahead. And what I will do is, just to speed things up, what I like to do is a little different from some of the other videos. And don't worry, you guys, this is going to be, I'm recording it, so it's not lined up on the camera there, but I'm recording it, so don't worry. It might go on YouTube. I might have to do a new voiceover. But some of the videos online, they cut them kind of from the side. I like to cut from the apex, almost like a calendar. You flip it open, like, from bottom up. That just seems a little easier for us. So what I'm going to do is get the larger knife, like a brain knife basically, and try to show you the angle. So what I'm going to do is try to cut it. And again, reorient yourself. Look for the anterior pulmonary trunk, and then try to cut it right in the center, which is really not easy. Slightly anterior, I would say. The warning I give everyone is that every single heart is going to be different. So cutting in the middle of one will be great, and another one will not be in the right spot because they're all different. And what I mean by right spot is that where you could see all the valves easily. Sometimes all you see is a big chunk of myocardium rather than the valves. So you want to get your hand above the knife as soon as you can. As soon as you get a little kind of slice started, then you want to, you can start down here. As soon as it gets in, you want to move your hand so you don't get cut. And it's kind of a sawing action with very light force. Open it up. This one's not too bad. Okay. You can see, let's get, my fingers are a little large, so let's get this probe here. We got the chordate tendonae. Okay, see that? It is very strong for its size. Okay, it's very thin but very strong. That goes just as well for this is one of the valve cusps. I know this is the left side because this is much thicker here. So that, again, this is the mitral valve or bicuspid. The valve cusp is very thin compared to a lot of things, basically. It's almost, I say it's almost like a nylon, okay, because it, you pull pretty tight and it still won't tear. That has to be, you know, it has to be really strong, but it also has to be flexible because when the blood pumps, it'll close. But let's, that's just the valve. It's the first thing I noticed, so I talked about it, but let's talk about the bigger stuff. So again, left side, because it's thicker, interventricular septum, the right ventricle. This is all ventricle down here, all this. The atria are pretty much invisible from here. So if you go on the outside, you can see them. That's the, I know that's the left atrium, that's the auricle of it. Okay, it's a little flap here. Okay, and there's the right side. And those are in there, but they're pretty much compressed from probably from the shipment and the storage and that preservative. The hearts that we get have no, almost no fumes, no smell, almost. So they're pretty nice to work with. So what I like to do is kind of a mind exercise to figure out, or have the students figure out where the blood, where it will start, where it will end, where it gets oxygenated, where it gets deoxygenated. So we're always going to start with blood entering the heart, and that should be from the Vena Cava or superior and inferior vena cava. That's not always easy to find, again, because these are cut so close. That might be, let's see, I think that's going to be it. What I find is it's hard to find the inferior side of it sometimes. And we don't have to do that, but I'm almost certain that that's going to be the vena cava, probably the superior. And if I'm correct, that'll go into the right atrium and then cross right through the right AV valve, which is the tricuspid valve, then go into the right ventricle. And the key is to use a smooth probe, not a blunt or not a sharp probe. Smooth probe and go very gently. If there's a lot of pressure needed, there's a problem. So I'm going to rotate it and push while, I'm going to push at the same time. And now it's moving on its own. So that should be easy. Look at that. I'm in the right ventricle. I know it's right again because it's thinner, the wall here. Okay. See if we could find that moderator band that a lot of times people talk about that. There's on the other side. So what you have to keep in mind here is that you cut it into two pieces. So even though it looks like two chambers, obviously this would be a single chamber here on the right. Single chamber once you close it. So you have to figure out where based on where you cut it, you got to figure out, so where does the pulmonary trunk exit? We know it exits from the front, almost totally anterior, so we know that it should actually be going up here. Okay, that would be the next vessel that we're going into. So I should be able to go from, actually I like to go from the outside. So it's always the first one that you're going to see out here. Go from the outside. Same policy, we'll call it. You're going to rotate and push. Gently push. And this is a little tougher because what I find is that it gets stuck in the right ventricle, and there it is. And you might want to put your thumb in there to feel for that probe. I think I broke the moderator band. I think that's okay. Okay, so we're going to go back out. So you bear with me. I'm going to get the pipe cleaners. Okay, so we are starting by convention. I guess we'll start with blue. We'll say deoxygenated. So why do we want to return blood to the vena cava? That is because it has to go then to the pulmonary trunk to get oxygenated in the lungs. Okay, so I designed these little tools. They're actually a little too thick. I used a Dremel tool actually. I hope that'll focus a little bit. That's okay, but I used the Dremel tool to put a hole in this. Is actually just a piece of a plastic hanger, and I cut it at a kind of a slope. In hindsight, it might have been easier to make it rounded, or it would be easier to manage, probably harder to cut that way. So what we're going to do is probably start, actually doesn't matter, but why don't we go ahead and start in the Vena Cava, and then the right atrium. And what I'm going to do, same policy, gentle, never a lot of force. Okay, so it's in there, but it's stuck in something. There we go. See that? That is the right ventricle. I'm going to go with my blue, which is saturated with fluid, but that's going to be okay too. Let's go ahead in here. And this looks like a small hole, but these are pipe cleaners, so they're very narrow, very tight, and small metal. So it'll fit right through there. Very tiny pieces of metal. So not a bunch of twists. It doesn't have to be super strong. You just so it doesn't fall apart. So I pulled it back out through the Vena Cava. If you can do it with one hand, that's great. Untwist it, hold it tight, and then pull it off there. So now we don't want to lose it. We don't want to pull it all the way through. In the end, it's going to be kind of, for a nerd, I suppose, exciting, because in the end, we're going to tie the blue with the red. Okay, and that's going to symbolize loss of oxygen throughout the tissues. That'll be at the very end. But right now, we still didn't get oxygen, right? And so we need that oxygen. So let's go through the pulmonary trunk. Remember, that's going to split into the pulmonary arteries, left and right pulmonary arteries. This is going to be a little tighter, so we're going to have to be as gentle as possible here. Just know where you're supposed to be going. Remember, it's got to go at an angle, because that's where the ventricle is. So we can't go straight down, because that'll cause problems. And it's always good to look inside. Look, so you could see the white in there, but it's kind of stuck almost. There we go. So same idea. This is the trick. I always like to pull through rather than push through. It's the natural kind of flow of this. It just works a lot better. Twist a little bit, pull it through. Look at that, beautiful. This is getting more and more fun. Okay, so let's keep going, because it's working this time. Let's see, keep going and untwisting. So guess what? We're going to the lungs, because guess what? This is pulmonary, right? So anything pulmonary we know is lungs, right? So we're going to the lungs, hitting the alveoli, getting all that oxygen, losing the CO2 so we don't get acidified, right? Just a little extra information there. I'm going to tie that in a little bit. I don't want to tie it immediately, but I want to show you where we're going to go. This is one of the hardest things with these preserved hearts, is to find, basically finding the pulmonary veins. Really hard for me. I'm not a cardiovascular surgeon or anything. I'm actually a pharmacologist, so a little bit tough. But let's look over here. I think that's one of them. So remember, there should be 4 openings for the pulmonary veins. They're really hard to find. So that one will be sufficient, and I'm getting really lucky with this heart. Notice how that's going right through the bicuspid or mitral valve into the left ventricle all the way. And then guess what? It has to leave and go to the aorta. You can probably guess where that would be, because there's only one channel left. I'm going to call that a channel because it's sunken in like a creek, or in northeastern Pennsylvania, a crick. Okay, so we're going to go up here and go right through the aortic semilunar valve, right out the aorta, and through the rest of the body. But we'll go back a little bit and go to the next step. So I'm going to go out. And that was a real easy one. They're not always that easy, to be honest. Okay, out. Remember, we're getting our oxygen at the lungs, right? Obviously, not at the kidneys. Okay, so we're going to get our oxygen. I think I could tie it off right now. That's a backwards twist for me, but I'll have to deal with that. It's a little weird. Let's go. Pulling it through. Look at that beauty. Beautiful thing right there. It's amazing. Everything's amazing, right? Like that other guy on YouTube. Let's see. That I won't mention. All right, so unhook this, or let me grab this, pull it. So we got our oxygen. It's beautiful. We're breathing. We get in. Remember, we go through the AV valve, mitral or bicuspid. To steal a term online again from one of the other excellent videos is try before you buy. So we have tricuspid is where the blood is first. It goes then through the lungs and all. Then bicuspid, try before you buy. So that's going to go in here. Remember, when it goes to the AV valve, this is going to squeeze. And when the ventricle squeezes, this valve has to close. If it does not shut, you have a mitral valve regurgitation, you have a heart murmur, you have blood going in the wrong direction. Okay, so then it's not going in where it needs to be, which is the tissues through the rest of the body in the brain. So we're going to go again up through the aortic semilunar valve, which you can't see. It's kind of buried. It's always buried under the pulmonary trunk. So where's the aorta? We'll pick your destiny, because, or your, at least your entryway, because we have aorta here, but this is brachiocephalic. This would be the probably the left common carotid. So I'm going to pick this one, but remember, it has to go again at an angle. So we're going to go this angle and try to be gentle. That's actually moving very easily, so I feel pretty good about that. There we are. So in this case, again, because it's cut in half, it's hard to say where it would fall or go into there, but it went up that side, up the top. So tie it off. Tie it off. Let's see. Twist it. Try to make it smooth so it'll go right through there. Pull gently. All right. Untwist it. This is where the magic happens, because this is the completion of that circuit. And that means this going everywhere, from the aorta, going through to the brain, going to the arms, going to the legs, going to the heart, well, it is going to the heart, but that's through the coronary arteries, which are in the, actually in the base of the aorta. But so no, this is going to go everywhere else though. We're going to, again, brain, arms, all the organs. Okay, and again, one more reminder, you can't see them here, but deep down at the very beginning of the aorta, hidden, there will be the beginning of the coronary arteries, right? And those will go and surround the heart. So the heart feeds itself with blood first, with oxygenated blood first, after the lungs. Okay, and then the rest of that, right, which is a large percentage of the blood, is going to keep going. Instead of going through the coronary arteries, it's going to go straight through the aortic arch, which is missing here. Actually, the aortic arch would be down here, where it's going to go through that. It's going to go through all the main arteries, and then all the capillaries, arterioles, capillaries, venules. So anyway, we're saying capillaries, right? We get far enough, we have all those capillaries. You lose oxygen because you need to metabolize drugs in your liver. You need to exercise. You need, everything, right, needs oxygen, right, for, at some period of time, most tissues are going to have that. So, despite them being able to use glucose, they're going to need oxygen at some point. Okay, so we're going to tie that off to represent that loss of oxygen. We're short-circuiting, going right back, right? So we're going to skip all the organs, pretend all the organs are here, and then we're going to go right back to the Vena Cava. That completes the circuit. Okay, and I think that's about it. Okay, so we're going on YouTube.